Today, I'm going to destroy almost everything you believed about knee pain. And I fully understand how bold this statement sounds. But after 30 years working in orthopedics, I've come to conclusions that contradict what's written in most textbooks and what many of my colleagues say. The shocking truth is that almost everything you've been told about knee pain is either incomplete information or outright misconception. And the saddest part, these misconceptions cost people their health, money, and quality of life. Let's start with the most common myth. Knee pain means something is wrong with the knee. Sounds logical, right? The knee hurts, so the problem is in the knee. But reality is much more complex and interesting. Your knee is not an isolated organ. It's part of a highly complex biomechanical system. Imagine a bridge. If a bridge starts collapsing in the center, do you think the problem is in the central part? Maybe, but much more often the problem is in the foundation on one or both sides. The supports are sinking, the load is distributed incorrectly, and the central part of the bridge takes on excessive stress. The same thing happens with your knee. I remember a case that completely changed my understanding of knee pain. A man in his 50s came to me, let's call him Sergey. He had been suffering from debilitating pain in his left knee for 2 years. He had seen 5 doctors, had 3 MRIs, tried every possible medication. He was told about arthritis, about inflammation, about age-related changes, but nothing helped. When I asked him to take off his shoes and socks, I immediately saw the problem. Sergey had an old right ankle injury that he didn't even mention because he considered it insignificant. This injury happened 10 years ago, healed, and he forgot about it. But his body didn't forget. Because of this old injury, the right foot lost part of its mobility. Sergey unconsciously began to compensate for this by transferring more weight to his left leg. His gait changed so imperceptibly that he didn't notice it himself, but the left knee noticed. It was receiving 20 to 30% more load with each step. Thousands of steps a day, millions of steps over the years. The left knee simply wore out faster because it was working for 2. We started working not with the left knee, but with the right ankle. We restored mobility, corrected gait. In 3 months, the pain in the left knee completely disappeared without a single pill for the knee, without a single injection in the knee. This brings us to the second shocking fact. Most knee pain can be treated without medications and without surgery. I know this sounds like an advertisement for some miracle cure, but it's pure truth, backed by my experience and a growing body of scientific research. The problem is that modern medicine is geared toward quick solutions. A doctor has 15 minutes for an appointment. In that time, they need to listen to complaints, conduct an examination, make a diagnosis, and prescribe treatment. There's no time for deep analysis, no time to study injury history, lifestyle, movement, biomechanics. It's much easier to prescribe an anti-inflammatory and send the patient to physical therapy. But here's what I've discovered over years of practice. If you're willing to spend time understanding the true cause of pain, if you're willing to work on movement correction, strengthening the right muscles, and changing habits, the results exceed any medications. I've seen people who were told they needed surgery completely recover after 6 months of proper rehabilitation. I've seen patients with so-called hopeless arthritis return to active life without pain simply by learning to move correctly and distribute load properly. The third shocking truth, your age is not a sentence. How many times have I heard from patients, well, doctor, I'm already 50. It's normal for knees to hurt, right? No, it's not normal. Age is not the cause of knee pain. It's just a time factor. If you've been using your body incorrectly for 30 years, of course, problems will accumulate by 50. But I know 70-year-olds with knees that a 30-year-old would envy. The difference is not in age. The difference is in how you've treated your body all these years. Cartilage tissue does wear out with age. That's a fact. But the rate of this wear depends on many factors, most of which you can control. Proper movement, biomechanics, strong muscles supporting the joint, healthy weight, adequate nutrition, sufficient movement. All this determines whether your knees will be healthy at 70 or start hurting at 40. I'm tired of this culture that normalizes pain and dysfunction as an inevitable part of aging. This is not aging. This is the result of decades of neglecting your body. The fourth shocking truth concerns diagnostics. MRI and X-rays don't always show the full picture. Moreover, they often mislead. I can't count how many times I've seen patients who came with MRI results showing meniscus tears, degenerative changes, bone spurs, and they were panicking, convinced they needed surgery. But here's what's interesting. Studies show that a significant percentage of people without any knee pain have the same changes on MRI. Meniscus, tears, arthritis, anything but no pain. What does this mean? It means that the presence of structural changes doesn't always equal pain. And conversely, the absence of serious changes on images doesn't mean there's no pain or that it's in your head. Pain is a complex phenomenon that depends not only on tissue condition, but also on how your nervous system processes signals, on the level of inflammation in the body, on your emotional state, on many other factors. I've seen people with minimal changes on MRI who couldn't walk from pain, and people with horrifying images who played tennis without problems. This doesn't mean MRI is useless. It means it needs to be interpreted in the context of the clinical picture, not used as the sole criterion for treatment decisions. Too many surgeries are performed based on images rather than the patient's actual functional state. This leads to unnecessary interventions that not only don't help, but sometimes worsen the situation. The fifth shocking truth: inflammation is not always the enemy. Yes, chronic inflammation is destructive and needs to be controlled, but acute inflammation is a natural healing process. When you injure your knee or overload it, the body sends inflammatory cells there to start the recovery process. Swelling, redness, pain, all these are signs that your body is working on the problem. But what do? We immediately grab anti-inflammatory drugs to suppress this process. I'm not saying you should endure pain and do nothing. I'm saying you need to understand the difference between acute and chronic inflammation and not interfere with the body doing its work in the acute phase. The first 48 hours after injury is the time when the body launches recovery processes. Aggressive suppression of inflammation during this period can slow healing. Ice, rest, elevation, yes, but don't rush with strong anti-inflammatory drugs if the pain is tolerable. The sixth shocking truth is related to nutrition. What you eat directly affects the health of your knees. And I'm not just talking about weight, although excess weight is certainly one of the main risk factors. I'm talking about nutrition quality. Your cartilage, your ligaments, your tendons, these are all living tissues that need nutrients to maintain their structure and function. A diet rich in processed foods, sugar, and trans fats creates systemic inflammation in the body. This inflammation makes your joints more sensitive to pain and slows recovery processes. On the other hand, a diet rich in omega-3 fatty acids, antioxidants, quality protein, and microelements supports joint health and reduces inflammation. I've seen patients who significantly reduce knee pain simply by changing their diet. No medications, no procedures, just food. But this is rarely discussed in orthopedic offices because doctors aren't taught nutritional science. We learn to treat diseases, not create health. The seventh shocking truth: your brain plays a huge role in knee pain. Chronic pain is not just a signal from damaged tissue. It's a complex process involving the entire nervous system, including the brain. When pain becomes chronic, the brain can start perceiving even normal signals from the knee as painful. This is called central sensitization. Essentially, your pain signaling system becomes hypersensitive, like an overly sensitive car alarm that goes off at the slightest touch. This explains why some people continue to experience pain even after the structural problem is resolved. Tissues have healed, inflammation is gone, but pain remains because the nervous system is still set to danger mode. Working with this aspect of pain requires a completely different approach. Brain retraining techniques, graded exposure to movement, cognitive behavioral therapy help here. Sounds strange for treating a knee? Perhaps, but it works. And ignoring the psychological component of chronic pain is one of the main reasons why so many people can't find relief. The eighth shocking truth: a sedentary lifestyle kills your knees faster than an active one. Many think the opposite, that the less load on the knees, the better. This is a fundamental misconception. Your joints are designed for movement. The cartilage in the knee joint has no blood supply of its own and receives nutrition through diffusion from synovial fluid. This fluid circulates only when the joint moves. When you sit 8 to 10 hours a day, your cartilage literally starves. Muscles atrophy, ligaments lose elasticity, the joint capsule becomes stiff. Then, when you suddenly decide to go for a long walk or start exercising, your unprepared knee can't handle the load. Pain occurs, and you think, see, movement is bad for my knees. But the problem is not movement. The problem is that you didn't move for too long and then gave a sudden load. Regular, moderate movement is the best prevention of knee problems. Walking, swimming, cycling, properly selected exercises, all this supports joint health. The ninth shocking truth: surgery is often not the final solution. I'm a surgeon and I perform knee surgeries. But I also know that surgery should be the last resort, not the first. Too many people go for surgery without exhausting all conservative treatment methods. And even when surgery is necessary, its success largely depends on what you do before and after it. If you don't eliminate the factors that led to the problem, improper biomechanics, muscle imbalance, excess weight, the problem may return or transfer to the other knee. I've seen patients who had arthroscopy, then 5 years later, joint replacement, and they still complained of pain because nobody taught them to move correctly. Surgery can fix a structural problem, but it won't change your habits, your lifestyle, your attitude toward your body. Without these changes, you'll just get temporary relief. The 10th and final shocking truth: you yourself are responsible for the health of your knees. Not doctors, not pills, not surgeries. A doctor can guide, provide tools, perform necessary procedures, but the daily work of maintaining joint health lies with you. This means regular exercise, weight control, proper nutrition, attention to your body's signals, movement correction. It's not quick and not easy. It requires discipline and consistency, but it works. Forget everything you knew about knee pain. Forget that it's just age. Forget that the only solution is pills and surgery. Forget that you're powerless. The shocking truth is that you have much more control over the health of your knees than you've been told. And this is not just encouraging words. It's a reality I observe every day in my practice.